Right, there are many things that can bring on a headache, right? Maybe allergies, stress. We're lucky to have a program here that helps people deal with exactly that. Dr. Brian Grosberg is the director of the Hartford HealthCare Headache Program. He joins me now. Good morning to you.
Good morning.
Let's talk first of all about what this is. What is the headache program?
So the headache program, there are very few headache programs, true multidisciplinary headache programs in the entire country.
So we're lucky to have one here.
We are.
And there are a lot of people that suffer from this, right? We're talking headaches, but also migraines, too.
Yes, there are 38 million migraine sufferers in this country.
That's a huge number, actually.
Staggering.
I'm surprised by that.
Staggering.
And for people that think, there's not much that can be done, frankly, the good news is there is a lot.
There's a tremendous amount that can be done.
Yeah.
And there are new treatments even within pipelines that people are not aware of. And what we're doing here with the headache program is capitalizing on our missions of providing personalized headache care, advancing clinical research, and training future leaders in the field of headache medicine. And there are very few headache specialists in the entire country.
Which is surprising, considering it's such a prevalent problem.
Yes.
So what is the difference between a headache and a migraine? So this is not just for, people think, well, I just get headaches occasionally, but kind of chronically. This is for them as well, right? This isn't just if you're suffering from these awful debilitating migraines.
That's correct. So migraine isn't just a headache. There are over 300 different types and causes of headache. So when somebody says, I have a headache, I say, back up a little bit, let's get some more history.
Okay.
Migraine is a headache plus, right? So a headache is a symptom. Migraine is a neurological condition where people have pain in the head, but they also have hypersensitivity. Their brains are generally more excitable. So the perception of light is heightened, the perception of sounds or noises. Some people may have nausea. So it's a constellation of symptoms that people end up experiencing, and migraine, we know, often undergoes undiagnosed.
And so once they come to the headache program, like you say, it's custom. You try to figure out why this is happening, what exactly the symptoms are, and then comes the treatment plan. Is that kind of the goal?
Yes. Through a detailed history and examination, we look for things that may be indicative of migraine or another type of headache condition. And then we look at combining a non-medication and a medication approach, so what we consider called a multidisciplinary approach, in order to be able to end up providing optimal care for each patient, because no two people with headache or migraine have the same type of preferences or the same treatment plans.
That makes your job hard.
It does.
But this is hopeful, and it's certainly promising, and again, we are lucky to have the headache program here. So if you're suffering from that, just know that there is help available. Thank you so much for your time and for sharing that.
Thank you.